Hi, my name is Stacy Thomas, and I chose to do my presentation on magnet status hospitals. I chose this topic because the hospital I currently work at has been trying to achieve magnet status for the last several years. We as employees hear so much about magnet status, and I wanted to research it and find out if our efforts are truly worth it. I found a lot of research on magnet status and the positive ways that it is affecting nursing. I'm happy to work for a hospital that is working to achieve this status and hope that the hospital will achieve this very soon. The objectives for this PowerPoint are to define magnet status, define the impact magnet status has on nursing, and define current research on magnet status. Introduction and background. The Magnet Recognition Program was developed by the American Nurses Credentialing Center, also known as the ANCC, to recognize excellence in nursing services. In 1983, the American Academy of Nursing, the AAN Task Force on Nursing Practice in Hospitals, conducted a study to identify work environments that attract and retain well-qualified nurses who promote quality patient, resident, and client care. 41 of the 163 institutions possess qualities that enabled greater capacity to attract and retain nurses, and were therefore described as magnet hospitals. The characteristics that distinguish these organizations from others are known to this day as the forces of magnetism. The forces of magnetism are attributes or outcomes that exemplify nursing excellence. Meeting every force is required to achieve magnet designation and embodies a professional environment guided by a strong and visionary nursing leader who advocates and supports excellence in nursing practice. The 14 forces of magnetism are quality of nursing leadership, organizational structure, management style, personal policies and programs, professional models of care, quality improvement, consultation and resources, autonomy, community and healthcare organization, nurses as teachers, image of nursing, interdisciplinary relationships, and professional development. The significance to nursing practice. The magnet model provides a framework to achieve excellence in nursing practice and serves as a roadmap for organizations seeking magnet recognition. The ANCC magnet recognized organizations serve as the fount of knowledge and expertise for the delivery of nursing care globally. Grounded in core magnet principles, they will be flexible and constantly strive for discovery and innovation. They will lead the reformation of healthcare, the discipline of nursing, and care of the patient, family, and community. Structural empowerment. Nurses throughout magnet recognized organizations are involved in shared governance and decision-making structures and processes to establish standards of practice and address opportunities for improvement. Nurse leaders serve on decision-making committees that address excellence in patient care and the safe, efficient, and effective operation of the organization. The flow of information and decision-making is multidirectional among professional nurses at the bedside, leadership, interprofessional teams, and the chief nursing officer. Nurses and nurse leaders develop strong partnerships with community organizations to improve patient outcomes and advance the health of the communities they serve. This is accomplished through the organization's strategic plan, structure, systems, policies, and programs. Impact to nursing practice. Magnet status hospitals were developed to help retain and attract well-qualified nurses. These hospitals support nurses and provide them with more autonomy and support the use of research of evidence-based practice. Research has shown that magnet-recognized facilities have higher patient satisfaction scores and high RN job satisfaction. This could be related to the better or more appropriate patient-to-nurse ratios or the fact that nurses are involved in every level of decision-making. Having better patient-to-nurse ratios allows nurses to focus on their patients more and decreases the amount of nurse errors. This, in turn, lowers healthcare costs and avoids unnecessary testing and procedures. Nurses are involved in all aspects of care in magnet-recognized hospitals. Nurses are on committees that look at patient and staff needs, and nurses are involved in the ideas to fix these areas. Nurses feel appreciated when involved in decision-making, thus making them more apt to participate in discussions. Nurses help develop interventions based on patient and staff needs, all while feeling heard and valued. The research done by Stipfel in 2012 supports higher quality of care as reported by nurses. This study showed a correlation between magnet recognition and higher quality of care. Impact to administration. Transformational leadership is another portion of magnet status. Nursing leaders at all levels of magnet-recognized organizations must demonstrate advocacy and support on behalf of staff and patients to transform values, beliefs, and behaviors. The Chief Nursing Officer must be strategically positioned within the organization to effectively influence other executives. Nursing mission, vision, values, and strategic plan must align with the organization's priorities to improve performance wherever nursing is practiced. Mechanisms must be implemented for evidence-based practice to evolve and for innovation to flourish. As a result, nurses throughout the organization should know and understand their voices are heard, their input is valued, and their practice is supported. Structural empowerment. Nurses throughout magnet recognition organizations are involved in shared governance and decision-making structures and processes to establish standards of practice and address opportunities for improvement. Nurse leaders serve on decision-making bodies that address excellence in patient care and the safe, efficient, and effective operation of the organization. The flow of information in decision-making is multidirectional among professional nurses at the bedside, leadership, interprofessional teams, and the Chief Nursing Officer. Nurses and nurse leaders develop strong partnerships with community organizations to improve patient outcomes and advance the health of the communities they serve. This is accomplished through the organization's strategic plan, structure, system policies, and programs. Impact on health policy. Magnet-recognized organizations integrate evidence-based practice and research into clinical and operational processes. Nurses are educated about evidence-based practice and research, enabling them to appropriately explore the safest and best practices for their patients and practice environment. Innovations in patient care, nursing, and the practice environment are the hallmark of organizations receiving magnet recognition. Establishing new ways of achieving high quality, effective, and efficient care is the outcome of transformational leadership, empowering structures and processes, and exemplary professional practice in nursing. Impact on research. Exemplary professional practice in magnet-recognized organizations is evidenced by effective and efficient care services, interprofessional collaboration, and high-quality patient outcomes. Magnet nurses partner with patients, families, support systems, and interprofessional teams to positively impact patient care and outcomes. Interprofessional team members include personnel from medicine, pharmacy, nutrition, rehabilitation, social work, psychology, and other professions that collaborate to ensure a comprehensive plan of care. Collegial working relationships within and among the disciplines are valued and promoted by the organization's leadership and its employees. The achievement of exemplary professional practice is grounded in a culture of safety, quality monitoring, and quality improvement. Nurses collaborate with other disciplines to ensure that care is comprehensive, coordinated, and monitored for effectiveness through the quality improvement model. Nurses at all levels analyze data and use national benchmarks to gain a comparative perspective about their performance and the care patients receive. Magnet organization data demonstrates outcomes measures that generally outperform the benchmark statistic of the national database used in patient and nurse sensitive indicators. Magnet facilities support evidence-based practice and also support and fund research to provide the organization with the evidence to base their care. The first research article that I found was titled Decisional Involvement in Magnet Aspiring and Non-Magnet Hospitals. And this was a survey that measured how staff felt they were involved in decision making. So this study took place in 2012. It was studied at 14 facilities. 2 were magnet facilities, 3 were magnet aspiring, so in the process, and 9 were non-magnet facilities. At those facilities, 5,000 staff RNs and administrators were sent surveys. Of those 5,000 surveys sent out, 1,407 completed their surveys, so the results of this study were based off of those surveys. And the results showed a significantly higher decision involvement score in magnet hospitals versus non-magnet hospitals. The method was a non-experimental descriptive survey. And the recommendation was to do studies on interventions that balance the actual and preferred perceptions of decisional involvement between administrators, managers, and then staff RNs. The second research article was titled Magnet Hospitals, Higher Rates of Patient Satisfaction. This was done in 2012. And this study just tried to prove that patient satisfaction was higher in magnet hospitals. So they sent out a survey to 1,742 hospitals. Of those, 160 were magnet, 99 were magnet in process and non-magnet. The method was secondary analysis of data collected and compiled from 3 secondary sources, so it was a cross-sectional analysis. The results were that magnet and magnet in process hospitals had statistically significant increases in the percent of patients assigning the hospital the highest positive rating on the 6 of the 7 survey questions. So what that means is that the surveys, the magnet hospitals received the highest rating over non-magnet hospitals on 6 of the 7 survey questions. The recommendation was to have future studies include an investigation into the relationships identified in the study via longitudinal design instead of just cross-sectional. The third research article that I found was titled Understanding the Role of the Professional Practice Environment on the Quality of Care in Magnet and Non-Magnet Hospitals. This was done in 2014, and this was looking at the quality of care in magnet versus non-magnet hospitals. They had RN surveys from 551 hospitals. Of those, 56 were magnet and 495 were non-magnet hospitals. The method was secondary analysis of cross-sectional data. The results, magnet hospitals had better nurse-reported quality of care. So this study went off of how the nurses reported it. It didn't go off patient-reported quality of care. The recommendations, this one again, instead of just doing cross-sectional, recommended doing a longitudinal study to confirm relationships found in the cross-sectional research. So just further research. Self-assessment, I think overall I did a good job finding the research. I learned a lot this semester of how to research at the library and how to look that stuff up and which research articles are good and not. I think that my slides are nice. They're not too overcrowded. They're organized. They flow nicely. The weaknesses, the overall flow of my presentation, how things kind of carried through, I think I could work better on that. And then the tempo and the pace of the presentation, I think that I could also work on. References are next. And then this is the end of my presentation. I hope that you enjoyed this presentation. I hope that you learned a little bit about magnet status, and I'm excited about what the future holds for magnet status for the nursing career, and I'm especially excited about the hospital that I work at to see if we can achieve this. It seems to be a big feat, but I hope that we will get there soon, and I hope that other hospitals in the area will follow suit to help make the nursing profession better. Thank you.